Right, so we are live with Dr. Vinita Dubey. She is the Associate Medical Officer of Health for Toronto. Welcome, Dr. Dubey.
Thanks for having me again.
So this is another live question and answer session with the doctor. My name is Dilshad Burman. I am a web writer with CityNews and 680 News, and I will be moderating this chat today. We have been asking our audience to send us questions over the past week, and we've got a lot of good ones for Dr. Dubey today. So let's get started right away.
Okay.
The first one comes from Andrea. They ask, if you still have to work and you return home, like if you're an essential worker, you go to work and you come home, is it okay to be hanging out with your family? My coworkers, she says, are hanging out with family, and I have been living in the garage. Should I be wearing a mask while at home on my days off as well?
It's a good question. Some of it depends on the kind of work that you do. And if there are concerns where you work that you might be picking up the virus, you might want to consider taking preventative measures at work so that you don't feel afraid when you come home. There are certainly people who live in homes that have vulnerable people they live with, like people who are either very old or who might be undergoing chemotherapy, and they want to take particular precautions because if they get the virus, they don't want to spread it to them. And so I think it would depend on your individual circumstance. We do know that if you're infected with the virus, you can actually be contagious 2 days before you even have symptoms. So I think the best advice I could give you is to try and prevent getting the virus. If you're an essential worker, thank you for being an essential worker, but try and maintain that physical distance. If you work in a hospital, make sure that you're wearing your PPE correctly, make sure that you're washing your hands so that you're less likely to bring anything home with you.
Okay, the next one comes from Camellia. She says, is it safe to eat takeout, and do we need to reheat the food when we bring it home? And if so, does a microwave work for that? And she says, most importantly, can I eat sushi?
It's a good question. And I want to reassure you that to date, we don't have any cases of this virus that have been recorded from eating food. And so we know that the virus is not spread through eating food or through food packaging. It's spread through respiratory droplets and through contaminated surfaces when you have them on your hands and when you touch your eyes or touch your nose, that's how you could get the virus. And so what I would say is absolutely you can eat takeout. When you bring the takeout home, if you put it on the counter, if you, before you eat it, make sure you reheat it. Actually reheating food can actually be good to kill viruses and other germs. You can reheat it in a microwave if you're sure that you could get the right temperature, or you could reheat it through other ways. But with the containers themselves, you want to make sure that you clean surfaces after you've touched the containers and make sure that you wash your hands.
So speaking of surfaces then, this is a question we've got from actually multiple people. Can you reconfirm how long the virus remains viable on different surfaces?
So it depends on the surface. We know that the smoother and flatter the surface, the more likely the virus is to live on that surface for longer. So something like stainless steel, maybe soft plastics, the virus might be able to live on that for longer. But something like paper, cardboard, tissue, the virus actually might just be able to live for a few hours. Public Health Ontario actually recently did an assessment of this and found that things like cardboard, paper, tissues, the virus lasts for maybe hours, but things like stainless steel, it can last for days. So again, things like stainless steel, actually, they're quite easy to disinfect by using a wipe or to clean it. And so that will actually also help to get rid of any viruses if they're lingering.
So cardboard containers for food and things like that definitely would be a possible, not carrier, but the virus could live there possibly longer. So definitely something to watch out.
No, on cardboard surfaces, it actually lives less long. So it doesn't actually survive. It doesn't survive as well on paper type products. So that's reassuring. Yeah, exactly.
Yes, definitely. When you bring home takeout or a pizza or something, definitely.
Yeah.
Definitely. Okay, the next one, we had a few questions from our own newsroom this time as well. So our producer, Mike Visser, has a question about community spread. He says, we keep hearing the phrase community spread, and officials are saying that the number has to go lower before we can reopen everything. But do the city and the province have a grasp on what communities are spreading the virus, in the sense that are they the people that are disobeying social distancing laws? Does it include healthcare workers who are accidentally bringing the virus home? Or are people contracting the virus just by visiting the grocery store or going on the TTC, and using other essential services? So he would really like to know, what we can do to work together to bring the numbers down.
Yeah, it's a good question. And we've had over 6,000 cases in Toronto. And so we've actually looked at this a bit further. And so we know that actually half of our cases are related to an institution, like a long-term care home, a retirement home.
Yes.
Either an outbreak in those settings, or either visitors who have gone to those settings, or staff who have gotten it from those settings. So that makes up half of our cases.
Okay.
Another 25% or a quarter of our cases come from people who have had close contact, either living in a household with someone who had the infection, or who are identified as having close contact from a workplace or something like that. About 7% of our cases have come from travel or travel related. And then the remainder, less than 20% of our cases, we're calling them could be community spread. Some of them, it's a data issue. We don't actually have an input. We don't know if it means that we didn't ask the person or we didn't input it correctly. And some of those are actually, we can't quite pinpoint where they got the virus. So that's the number that we're dealing with. And that's the number that we want to go down. But we know by and large that people are getting the virus from that close contact, and having that close contact for 15 minutes or longer, for example.
Okay. So this other one again is about masks. We always get a lot of questions about masks. Firstly, do you think that wearing masks will become mandatory when people step out for shopping, whether it's now or even once the virus sort of starts to go out?
This is something that we're actually looking at. So in Toronto, we're starting to talk about what will it take for us to be able to start opening up some of the places in Toronto. Yes. And something like wearing masks, like a cloth mask, when you go on transit or when you're in the grocery store, is something that we're looking into. Right now, though, I would recommend in general, we're saying that if you go to a place like a grocery store or you're on transit and you can't always maintain that 6 feet of physical distance, then wearing a cloth mask is something that you could actually consider. And that what it will do is it will protect your germs, to keep your germs to yourself. And so it will, in general, can help protection overall.
So the other question, sorry. So the other question we get a lot then is, why aren't they being made mandatory?
Well, so this is something that we're actually investigating. We want to see is if making everyone wear a mask, will that help us to prevent the spread overall? So while it sounds really great, if everyone just wears a mask, when you wear a mask, you protect me. When I wear a mask, I protect you. Yes. It sounds really great, except if we don't wear the mask properly, we can actually contribute to spreading things further. Because when you have the mask on, if you're itching by the mask, if the mask is causing you to touch the mask and then you might rub your eye, well then whatever germs are on the outside of the mask, you've actually now contaminated yourself and could have contributed to spread. So these are all the kinds of things that we have to look at when we decide, because making something mandatory is actually quite something that we want to be able to get all of our evidence before we'd even consider that.
Yes, because then it's a matter of enforcement as well, and how do you get everybody to comply and that kind of thing as well, right?
That's right, yeah.
Okay, moving on. Aman would like to know if pregnant women are at high risk for coronavirus, and if a pregnant woman is still working, should she stay home?
So, I mean, we've only known about this virus since the end of December. And so actually we've only had, this is our 5th month of really learning about the virus. What we know so far is that pregnant women don't seem to be at any higher risk of getting severe illness. Although sometimes in pregnancy, getting an infection like a respiratory virus could make you more likely to get a severe infection, but it's not clear whether that's the case here for coronavirus. we don't think that it's being spread from the mother to the baby inside the womb. What's more likely is if a mother who is a pregnant person who's sick with the infection, if they deliver a baby, they could spread it to their baby that way. And so there are certainly precautions that you can take that way to help protect you. But I think the most important thing I would say to someone who's thinking about pregnancy or someone who is pregnant is to try and prevent getting the virus. You don't need to stay home. If you have a job, you can keep working unless you might be in one of those higher risk, have an other condition that might make you more vulnerable to this infection. But pregnancy itself is not necessarily one of those conditions.
Okay, wonderful. Ehsan is asking, this is about social distancing. She says, I have a 3-year-old daughter and she wants to see her grandparents. I'm not sure if it's safe to visit them after self-isolating for 14 days, or there might be a risk even after 14 days.
Right now, our recommendation still is that for grandparents, people who are 70 and older, that they stay at home. Because we know with this virus that the risk actually is quite high the older you get. So we know in Ontario that 60 and older are getting more serious illnesses. They're ending up in hospital or in ICU. We know that the deaths that have occurred have been in our older adults. And so what we want to do is to be able to protect our grandparents from getting the virus. And so even if you yourself have been at home for 14 days and you don't feel like you have it, we want to be extra cautious. And so I think for a little while longer, I would say if you want to see, if the grandparents want to see the 3-year-old grandchild, use some sort of a virtual connection method just for a little while longer.
Absolutely, because we definitely want to protect our elder population.
That's right.
So this one comes in right now from Irene. She says, individuals who have contracted the virus and have recovered, should they be discarding and replacing their health and beauty products and medications and toiletries and all of the things that you find in your bathroom medicine cabinet?
Yeah, that's a good question. And what we can say is that things that can be washed, put in the washing machine, can be washed and can be cleaned. Things that can be disinfected, like with a wipe, can be disinfected. Things like a toothbrush, it might be a good idea to get a new toothbrush. Cleaning the bathroom after you've recovered is a really good idea. What I would say is when you're sick, you should try and avoid using things that can be contaminated with your respiratory secretions, so coughing, sneezing, any of your body fluids. And if you're not sure, then absolutely you can throw them out, and that would be the safest way to go as well. Okay,
so makeup brushes definitely.
Yeah, I mean, you can't if you can't be sure that you can clean it properly, then there could be contamination on there, especially if you've used it while you're sick. Yeah.
Okay, so this is another question that we're getting a lot. A number of people have asked, but this one is from Barb. With summer coming and mosquitoes coming, do mosquitoes carry COVID-19 and can they transfer it?
That's a really good question. And we actually don't think that this virus is spread from mosquitoes. There are viruses that are spread from mosquitoes, like malaria, like West Nile virus. But this virus does not seem to be spread through animals or through mosquitoes. And so, again, we're learning about the virus. If there's more we learn about it, then we will definitely let people know. But that's not one of the ways that people are getting the virus. They're not getting it from mosquito bites.
Okay, perfect. This is, I'm not sure we have the data on this, but would you classify this pandemic as worse than the 1918 influenza pandemic?
We are saying that it's very similar. We're saying that's why we're saying this occurs kind of once in 100 years. At that time with influenza, I mean, that virus was influenza. And at that time, there were no planes and that virus still spread within months actually across the world. So there are definitely a lot of similarities. I think the one thing that we can say right now is that we have a lot of really good health technology and treatments, even though we don't have a specific treatment for this virus. We have ventilators, we can give you IV medication. So we have good ways to help you recover. And I think that that's what's actually really helpful to us now compared to in the early 1900s.
Okay, here's another one from our newsroom. This is from my fellow web writer, Meredith. Meredith asks, what will restaurants and bars be like if they are able to open, but we still have to social distance? How are we going to open businesses like that when social distancing measures are still in place?
It's a good question, Meredith, and I've actually been thinking about this at night, wondering what is it going to look like in Toronto. I can tell you that different places around the world have done this differently. So we've seen in places like Asia where they've put up plexiglass between tables and where so that you can't spread it to someone else. We've seen in places like Alaska, actually, where they only allow restaurants to have 25% occupancy, and you can only go there with your household members. And we've had other places say, well, you can have 50% occupancy, but you have to try and physically distance as much as possible. You have to, the servers, for example, have to wear masks. So there have been a lot of different places doing a lot of different things. And this is, I want you to know that this is something that we're actually looking into in Toronto and also for Ontario to come up with guidance for what it will look like as we move forward.
Okay, wonderful. There's actually a related question there. Dan asks, what public health concerns might there be with the resumption of organized sports for kids like hockey and basketball, if at all they do resume in the fall? What are the concerns there?
Yeah, so we have to actually look at each sport individually because some sports you have more personal contact than in other sports. So something like playing golf or playing tennis might be considered lower risk, and we might be able to play those sports sooner than something that has more contact like basketball or soccer. And so I think what we'll see is that when we start opening things up, we may start saying that, well, these sports you can go ahead with, but right now these sports are still not considered safe because of we can't maintain that physical distance while playing those sports.
Right, that makes sense, of course. Let's see, we've got a question from DS. Why are we still using predictive contagion models to determine next steps instead of real-time data?
Well, we're using both actually. So our real-time data is really helpful. What we do know though is that in some of our real-time data, there's a bit of a lag. So by the time we get notified of someone who has coronavirus, they've been tested, they've been lab confirmed, and they've been notified by public health. And they may not get tested until a few days into when they have symptoms. And so there are inherent lags there. We also know that the incubation period of this virus is 2 weeks. And so the cases that we have today, we won't know who they've spread it to until another 2 weeks from now. And so that's why we use our current data, but we also use some of our models based on the characteristics of the virus to be able to help us to see, well, what will it look like 2 weeks from now?
Okay, here's another physical distancing question from somebody who calls themselves Superstar. People use aliases all the time. So why aren't we mandating or suggesting one-way sidewalks? If everybody's walking the same way, then human contact can possibly be reduced instead of people sort of passing each other.
Well, I can say in Toronto that we have a new initiative called Curb TO, and that's our transportation services are actually looking to the sidewalks in the city and to expand what's called that curb lane, that lane that's right beside the sidewalk, to be able to open it up to make it accessible to pedestrians or cyclists. And we know that places around the world and even within Canada have taken that approach to widen the sidewalk and bike lanes to be able to make it easier for people to walk, cycle or jog while being able to maintain physical distancing. So we are certainly actively trying to implement those things to be able to make it safe for individuals. That being said, I think it's worth mentioning one thing, that if you're passing someone on a sidewalk or in a bike trail, if you do it quickly and courteously, the risks of actually getting infected are low. And so I think that's also important to keep in mind.
Okay, yeah, because that is definitely something that people bring up a lot. If I'm just passing somebody, very quickly, is that going to be, a high risk situation?
And the answer is no, that's not a high risk situation. And so what we're telling people is to step aside, courteously pass someone, and to keep going. And that is a lower risk situation.
Okay, this is about COVID-19 deaths. DF asks, when there's a COVID-19 death, what are the criteria to determine whether it will be listed as a COVID-19 death? For example, if somebody tested positive for COVID-19, but then has a heart attack and passes away, what would the cause of death be there? And would it then be COVID-19?
So right now, what we're doing is if you have COVID-19 and you die, we're counting that as a COVID-19 related death. Okay. And the person who asked the question is absolutely right. You could have died of a heart attack and just happened to have COVID-19, but we're being extra cautious and calling that a COVID-19 related death because we know that the infection can sometimes make chronic health conditions worse. And so we want to make sure that we're not undercounting some deaths for that reason.
Okay, here's another one from our newsroom. Our producer, Michelle, asks, is it okay to visit your parents, families, or friends if you stay 6 feet apart from them? If you hang out in a backyard, perhaps, but you're still 6 feet apart. And also, if two people both live alone separately, and then decide to pair up and live together and become a family, so to speak, is that okay as well?
So right now the rules are that people, groups of 5 or more should not congregate. And so that is the provincial order that's currently in place. And so if you are in a household though, you can certainly stay connected with your immediate household. Getting together in a backyard, for example, keeping that 6 feet distance, while it seems like it might not be a risky thing to do, right now, while we're still waiting for the numbers to go down further, we're just asking people to still maintain that caution for a little while longer, because we know what happens is, you know, you inch forward, now you're 4 feet, 2 feet close together. You might have a conversation. You might decide to go inside to use the facilities. And then that's how we can end up with spread. And we certainly have had cases where people have gone to drop off, say, essentials for someone who was in need, stopped in for a quick visit, and then there was spread of COVID in those situations. So those are the situations that we're still trying to prevent until the infection in our community is still has gone down just a little bit more.
Okay, and then the part 2 of that was if there's 2 single individuals, we know that getting through isolation is probably easier with a partner or a friend. If they're 2 single individuals living separately, can they then get together and live together for a little while and become like a family unit?
Yeah, I mean, there's not a lot of policing on these types of things. Again, if you're living in the same household, that's, you know, then your risk is you're interacting with those people in those households where you're not keeping that 6 feet distance. And so you recognize that that's your household. And so we're certainly not telling people who they can live with, but we are asking people to take precautions and just to beware of how the virus is spread.
Absolutely. Let's see, there's another one. This is again another one on physical distancing, slightly different. What is your view on one-on-one friend outdoor meetups where physical distancing is enforced? Like, can I go to maybe an outdoor picnic, but then set up 2 separate blankets on a park and still talk to my friend 6 feet away?
Right now, the parks and green spaces are closed. They haven't been opened yet. And so we're hoping that in our first round, we might see that parks might be open. But again, right now, it's not that you can set up a blanket and kind of chit chat with someone six feet apart. That's not a good use of the park space right now. But we're hoping that as parks start to open up in our phases of recovery, that you could meet up in a park, and absolutely keeping that 6 feet distance will be really important as we go forward.
So any meetups though with just a single friend, would that be not recommended at this time?
Right now, we're asking that you stay with your household contacts, that if you have to go out for essentials, that you go out for essentials. If you're going to work, that you go to work. But again, when you're meeting up with individuals, that being able to maintain that 6 foot distance can sometimes be difficult. Yeah. And while the virus is still spreading in our community, we want to be able to prevent some of those unintended spread of the infection.
Mm-hmm. This is another question going back to hospitals. For the people that have been hospitalized or are in ICU, are most of them, or do we have numbers about their underlying conditions? And if so, what are those conditions? Yeah.
So we know that most people who end up in hospital are either older in age, or they have a chronic medical condition. There are, though, some young, healthy individuals who have gotten quite sick from this virus. We're collecting the data, and we're hoping that, when we have a bit more chance, we'll be able to analyze the data to be able to understand, well, how many actually had a health condition and how many didn't. But we know in general, those who get the severe illness, ending up in ICU, ending up hospitalized, do have some sort of underlying condition or are older to make them more prone to that.
Okay. This is a question that I've seen going around. I'm not sure if there's a rumor out there or what it is, but Serena asks, is this disease more serious for people with certain blood group types?
There's no evidence that your blood type is related to how serious an illness you get from the virus. No.
Okay, because I've seen that question a couple of times come up, and I'm sure there's some sort of, something floating around that's getting people concerned, but that's very good to know. Blood type doesn't matter. The virus doesn't discriminate, obviously. Let's see. Here's another one. Again, this is more about when things open up. Will a chlorine swimming pool be safe to swim in when things open up?
Right. So the chlorinated or bromine pools will likely be strong enough to be able to kill the virus in the actual water. The bigger risk in a pool, though, is maintaining that physical distance. So if you have a very crowded pool and you're close to individuals, even in a pool situation, you could be talking to someone in a pool, or someone could cough and you could spread the virus that way. The other thing about pools is to manage the change room areas, to make sure that we can keep that physical distance in those places. But the water itself is not likely to be a way that this virus is going to spread.
Okay, good to know. And then another one from our newsroom, my fellow web writer, John, asks, what is the current treatment for anyone who is battling COVID-19 in hospital? What is being prescribed to those patients in hospital who are not on a ventilator, just in hospital?
So there's no particular antibiotic or antiviral that can be used to combat the virus right now. And so the medications or treatments that you have in a hospital are pretty much supportive. So, you'll get fluids. If you're dehydrated, you might get medications if you have a fever. If you have a secondary bacterial infection, we might treat that with antibiotics, but that won't treat the coronavirus infection. Some are, and then there are a bunch of other types of medications that are being recommended or being used based on the situation, things like blood thinners and other medications.
So aside from treating secondary infections or secondary conditions, there's no real medicine per se that you're going to give somebody to say, okay, this is going to bring down your virus.
That's right. That's right. There's no antidote. There's no antivirus that can actually treat this infection.
Okay. So this one is from Joe coming in right now. What are the seasonal flu cases this year compared to COVID-19?
That's a really good question. And the flu virus, typically the season ends around the spring. And so the season has, there are not a lot of flu cases that are circulating right now. We know, though, that the flu is generally a big concern in Canada, 12,000 hospitalizations, over 3,000 deaths in Canada. I think at the end of all of this, we'll have to be able to compare to see how much more severe was the flu compared to the coronavirus. And that's something that we'll definitely look at.
Okay, so we have about 2 minutes left, so I'm going to start wrapping up. This last one is actually a good one about the lessons we can take away. According to the information provided by Ontario Health, people 19 and under do not seem to be affected as much by the disease as older adults. So aside from the fact that they are likely just healthier and they have stronger immune systems and they're not as compromised, are there some conclusions we can take away from this?
Yeah, so we haven't had as many cases in children. I think the one thing we have to remember is that children, teenagers, even post-secondary students have actually been home. And so they're not spreading the virus as much. And so that's a good thing. But what we do know is that when children tend to get the virus, they tend to get a milder form of the virus. They might not get very sick. That being said, there are some kids who have gotten quite sick from the virus, but by and large, children tend to have a more milder form of the virus. The other thing that we're looking at with children is to see if they get the virus, how likely are they to spread it to others? Because we know with things like influenza, children can actually get it and then they can actually spread it to others quite easily. And we're trying to see if that's the case with this virus as well.
So in terms of, this is the other one that we get a lot, is in terms of antibodies then, are we looking at testing younger adults? Are we looking at testing people that have recovered? Are we looking at testing people that never had it?
We don't have an antibody test right now in Canada. What we have is the test that can check to see if you've actually had the virus. But as we get good antibody tests come on board, it will be important to check to see what are people's antibodies. Do they have longer term immunity from their own infection that they've gotten, that they've recovered from? We're actually using the antibodies that people have developed when they've had an infection to actually help treat some individuals who have the illness. And so if you've had the infection and you donate your blood, some of those antibodies can actually be used to help save a life. But determining, antibodies in kids or in the general population, we call that surveillance. That's something that we'll be looking at as we go forward.
Okay, well, wonderful. Thank you so much for your time, Dr. Dubey. This was very, very informational, and hopefully we'll have you back again soon.
My pleasure, and hi to all your viewers.
Thank you so much. All righty. Bye-bye.
Bye-bye.